This is an ultrasound of a young lady presented to us with the pelvic pain and excessive bleeding after the placement of IUCD. Ultrasound is showing migration of IUCD within the lower uterine segment. Today we will discuss what are the different type of the IUCDs, what are the complications, and how you will diagnose misplaced IUCD on the ultrasound. These are four different types of intrauterine contraceptive devices. At number three is double S shape, but this was used in old days like 1960s to 1980s. At number four is stainless steel rings, which were used before 1993 in the China, and nowadays usually used T-shape intrauterine devices. Like these are liver nodules carrying T-shape, and the copper T are widely used. So how the copper T is placed in the uterus? That usually the stem is placed within the endometrial cavity. The two limbs are usually fit into the uterine horns, and retrieval strings are usually placed within the cervical canal for easily removal of the IUCD. So after the IUCD placement, most important complication is usually misplaced IUCD. On the ultrasound, the distance between the endometrial cavity and the IUCD, usually if it is less than 3 mm, then the position of the IUCD is normal. But if the distance is more than 3 mm, then there are the chances of expulsion and also increased pelvic pain and bleeding as well. But some studies shows that these type of IUCDs are usually repositioned within the next 6 months. These are the four different type of malposition. Like the first one is the expulsion. Passage of the IUCD completely or partial is called the expulsion, while displacement is the rotation or inferior positioning in the lower uterine segment or the cervix. Embedment is the penetration of the IUCD into the myometrium without the extension through the serosa, and the perforation is the penetration through the myometrium as well as through the serosa. This picture showing the IUCD placed within the lower uterine segment. This is the example of the expulsion. The next image is showing the embedment of the IUCD within the myometrium, but the serosal line is still present. And this is the example of the complete penetration and perforation of the uterine cavity with the IUCD, and the IUCD is present within the abdominal cavity in this X-ray. The other less likely complications are the fragmentation or the calcification of IUCDs. So in conclusion, after the placement of IUCD, you have to check the position of the IUCD on the ultrasound, and if the distance between the endometrial cavity and the IUCD is more than 3 mm, then you have to observe the position of the IUCD closely. If you have some questions, you can ask me in the comment box. Thank you for watching.